Yate, Chairwoman Ledger Fernández, Acting Ranking Member Obernolte, and distinguished members of the House Subcommittee for the Indigenous Peoples of the United States. I would also like to acknowledge Chairman Grijalva and Ranking Member Westerman, who preside over the House Natural Resources Committee. My name is Jonathan Nez. I am the president of the Navajo Nation. I testify today on behalf of the Navajo Nation as a member of the National Indian Health Board of Directors that serves 574 plus federally recognized tribes in the U.S. I'm here in a small community, Indian Wells, Arizona. We have some young student workers here that are helping out the community, and they got a lot of rain, and we were blessed with moisture, and of course that met the roads damaged and water lines being busted here in this region. So that is the reason why I'm testifying before you from this community. And I thank you for the opportunity to testify in support of HR 5549, the Indian Health Services Advanced Appropriation Act. Tribes and the NIHB are grateful for the bipartisan congressional support for advanced appropriations for the IHS as demonstrated in previous legislative and appropriation sessions. HR 5549, the Indian Health Service Advanced Appropriations Act, is a continuation of this bipartisan effort. The Navajo Nation and NIHB are pleased to see advanced appropriations included in the President's FY 2023 funding request. We urge Congress to include advanced appropriation for IHS in this fiscal year's appropriation bill. The Indian health system faces chronic challenges, and as you heard today from Acting Director Fowler, that are made worse by endless use of continuing resolutions, CRs, and the persistent threat of government shutdowns. IHS is the only federal health delivery program not protected from government shutdowns and CRs. This is because Medicare, Medicaid receive mandatory appropriations, and the Veterans Health Administration received advanced appropriations starting a decade ago. In September 2018, the Government Accountability Office issued a report that noted uncertainty resulting from reoccurring CRs and from government shutdown has led to adverse financial effects on tribes and their healthcare programs. As long as the uncertainty of CRs continue, so too does the threat to an interruption of the treaty and trust obligations for the only class of Americans with a federal treaty right to healthcare. In 2019, the most recent 35-day government shutdown, IHS was the only federal healthcare program directly harmed. Tribal facilities lost physicians because they could not continue working without pay. Doctor visits could not be scheduled because administrative staff were furloughed. Tribes took out private loans to operate or use their general funds. Contracts with private entities for sanitation services and facilities upgrades went weeks without payment, which threatened tribes' credit and putting patients' health at risk. During numerous consultations and congressional testimonies, tribal leaders shared stories of sacrifices made by administrative staff who volunteered to go unpaid in order for their tribe to have the resources to keep physicians on the payroll. These are just a few examples of the everyday sacrifices that widen the chasm between the health services afforded to American Indians and Alaska Natives and the nation at large. IHS is one of the 4 federal healthcare entities, the other being Medicare, Medicaid, and the Veterans Health Administration. A decade ago, Congress authorized advance appropriation for the VA. This shielded the VA from the effects of the 2013 shutdown and the 2018 shutdowns. To the contrary, IHS felt the brunt of each and every one of those shutdowns. The 2013 budget sequester was especially damaging, slashing the IHS budget by 5% or roughly $221 million on top of the impacts that year's shutdown. Other federal funded health programs such as Medicare and Medicaid are mandatory funding, meaning that these programs are automatically funded without annual appropriation and without the uncertainty seen in other areas of the budget. During federal government shutdowns, retaining physicians in rural reservation communities is especially challenging because they cannot keep working without pay. Preventing tribal members from scheduling follow-up visits with their doctors or get a referral because administrative staff were furloughed and obtain assistance through purchase and referred services, formerly called contract health, due to the frozen funds. Tribes struggle to keep up to date with payments to outside providers and contract. In rural Alaska, where transportation of goods and services is already more expensive, government shutdowns interrupted the ability for advanced purchases and price containment to be honored, which leaves Alaska Native villages to pay premium rather than discounted rates. Road closure after heavy snowfall on the Navajo reservation went days without being cleared, leaving tribal members stranded and have even claimed the lives of some of our people. Every community has been impacted by government shutdowns that could be avoided through advance appropriation. Advance appropriation for IHS is a bipartisan, bicameral policy initiative that increases tribal and federal government efficiency, reduces federal taxpayer, and saves Native lives by providing stable funding for healthcare services in Indian country. Since advance appropriations are merely advance agreements to provide funding at a later date, they are budget neutral and flexible solution to outsized impacts of funding disruptions on Indian country. The Navajo Nation is the largest tribal nation in the United States with over 27,000 square miles of land and more than 406,000 enrolled tribal citizens, roughly half of whom reside on the reservation land. As you know, the Navajo Nation was especially hard hit during the global COVID-19 pandemic. Prior to that, like other tribal nations, we were suffering the impacts of opioid epidemic. While there is no good time for government shutdowns to occur, it will take years following the COVID-19 pandemic before tribal nations are resilient enough to withstand another government shutdown. Advance appropriation for IHS is a step toward fully honoring the treaty and trust obligation for health. It would be a demonstrated commitment that Congress will enact solutions that address the health inequities and ensure the health and wellness of tribal communities. The insecurity surrounding discretionary funding for Indian health threatens the stability of healthcare delivery in Indian country. As we work together to restore promises, all options must be on the table for congressional actions. In conclusion, the Navajo Nation and now NIHB applaud Congress and the Biden-Harris administration for the commitment to honoring federal trust responsibilities. Advance appropriating the Indian Health Service would mark the first commitment by Congress to truly recognize the treaty and trust obligation for healthcare for Indian country and shield tribes from devastating impact on government shutdown. So we wholly support H.R. 5549. Thank you for your consideration of my testimony today. Thank you.
Thank you so much, President Nez. The chair now recognizes the Honorable Kirk Francis, who is the president for the United South and Eastern Tribes Sovereignty Protection Fund. You're now recognized for 5 minutes, and thank you.